Hi, this is Dr. Cannell with another short comment about a recently published paper. This time a paper in the American Journal of Clinical Nutrition. The lead author was Dr. Evatt from the Emory University School of Medicine. What they did, about 150 patients who had entered into a study group, a cohort for Parkinson's disease. And what the authors showed was it's tenable that low vitamin D levels contribute or are a significant factor in the cause of Parkinson's disease. The argument to date has been, of course, people with Parkinson's disease have low vitamin D levels because they stay inside. Well, what this study showed is that after you get Parkinson, in this cohort of patients, after you got Parkinsonism, your vitamin D levels actually went up, not down, and that in spite of the fact that the initial levels were drawn in the summer when they should have been higher, and the second levels were drawn in the winter and spring. So the levels went up in spite of the fact that they should have gone down just by the season. Now, the authors didn't know why these levels went up in these patients, but it disproves the idea that patients with Parkinson's have low vitamin D levels because they stay inside. It shows just the opposite. It showed another interesting thing. The subjects in the study were able to take some vitamin D in a multivitamin, and the subjects who declined to take it had higher vitamin D levels than the ones taking the vitamin D supplement. You see that a lot with multiple vitamins. I think that the other interesting thing was their discussion of how important vitamin D is for the brain, especially their discussion of glutathione. Glutathione is like it's what keeps the brain clean. It's not only a master antioxidant, but it helps get rid of heavy metals, and it's the brain's protector. And vitamin D is involved in the production and the maintenance of adequate glutathione levels in your brain. So the only thing I didn't like about this paper was that they didn't recommend that patients with Parkinsonism take vitamin D. That is, they didn't recommend that the vitamin D deficiency in these Parkinson patients be treated. The only thing they recommended was that more studies need to be done. They should have recommended that every patient with Parkinson's disease take vitamin D. My personal opinion is if you have Parkinson's disease, you should be on 5,000 or 10,000 units a day of vitamin D. It's just a chance that vitamin D will improve Parkinsonism is worth the lack of risk of taking 10,000 units a day. If you obtain blood levels, it simply there's just no risk associated with doing that, and it may well be helpful. Certainly 5,000 units a day at the very minimum, but that would be a case where I think the vitamin D levels should be kept in the upper range of normal, so 80, 90, or 100, in the hope that it will have some effect on the course of the disease. Thank you.